So I'm going to try to do this without turning this into a rant, but I don't know how good I'm going to do. Well, we'll see. I hurt my foot kind of a few months ago. And I was playing pickleball and just, like my heel was just really killing me. And I know like a common injury is, like either plantar fasciitis, Achilles tendon, blah, 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 blah. So I went through all that, is it an Achilles heel? I did all the stretches and exercises to try to fix that. Is it plantar fasciitis? I put the inserts in and did all that, right? Is it a fat pad issue? I started taping it and that kind of helped actually, but it didn't fix it. And I would get these like shooting pains out of nowhere. And it's been going on for maybe 3 or 4 months. And so like I had to stop playing pickleball and just kind of rest it. But even resting is not doing much for it. So, and my wife is like, would you just go to a freaking podiatrist and have somebody look at it? Because, I'm like, I don't need to do it. But it just wasn't getting any better. So I went to a podiatrist, and I want to say it was not a great experience. The one thing that really frustrates me in America is like this healthcare system is so bloody broken, and it drives me nuts. And the inefficiency of it all drives me crazy. So that's where that rant part comes in. But, I don't blame the doctors. I don't blame any of the staff and folks that are helping, the nurses, everybody's great. But the problem is there's a couple problems. One is that like, so many of them are so specialized that they don't, if the problem borders on things that are outside of their profession, their specialty, they don't really have a lot to say about it. So it's very, very frustrating. And the problem is like, I go into a doctor nowadays, and I'm sure you guys feel this too. And it's like you're rushed through. It's like the doctors come in, they got like 15 minutes to see you because in order for them to make money, they gotta, see a lot of patients. And if they don't, it's hard for them to pay their bills, right? And I sympathize with that. And I especially, I've been talking to some doctors, and you've seen some of the videos that we've done here on some medical things. The thing that's frustrating is the doctors, depending on what type of medicine they practice, it's easier to get paid from insurance with certain things that have very specific procedure codes and things like that. Things that like require more intellectual activity or, like more research and things like that, or, more just like diagnosing and things like that. It's harder for them to make that money. And so, like that's why you see, a lot of people just kind of piling into certain specialties. And for doctors, it seems that getting into those residency programs is really important. And one of the challenges is that for some of the residency programs that there's not a lot of great opportunity to make a ton of money in, a lot of the folks that are reluctant to go into those practices because they they got big student loans to pay. They got malpractice insurance. There's a lot of costs, if they're setting up their own office, whatever, and so they're stuck in a hard place. The people who set up the residency programs don't want to expand the residency opportunities because they want to kind of push people into more underserved residencies like general practitioners and things like that. So you've got this a lot of really bad incentives. Like if you want to go see a dermatologist, good luck in getting in there. I went to see an ophthalmologist because I had to have my eyes checked, and it took me months to get into it. To see an endocrinologist, I had an issue in April, and I still haven't seen my endocrinologist because that's happening in August, right? So there's an enormous amount of waiting that's going on, and it's very frustrating. It's very frustrating for the doctor. So you end up seeing like physician's assistants, PAs, and things, and nurses, and people like that, and they're not always fully equipped to give you the kind of answer that you want. So anyways, I go to the podiatrist. He kind of comes in, he pokes at a couple things, doesn't ask me a whole lot of questions. And like, I've got some things that could contribute to this. Like I have this Dupuytren's contracture, people call it Viking's disease, but it causes you to form sort of nodules in like kind of interstitial tissue. And I've got one on my foot that's having the problem, and it's making this very tight band of tissue in there, which could be part of the problem. I don't know. But, I mentioned that doctor didn't really, most doctors don't even know what that is, really, honestly. And I've had this occur in other situations where there's they're giving me things that will impact like connectivity tissue and things like that. And I'm like, hey, what about this? And I'm like, I don't know. So it's hard. It's frustrating. They've got to, focus on their thing, making money, and then they're getting tons of pressure because every hospital has been bought by private equity and yada, yada, yada. So it's a big problem. So anyways, here's my hack for you. So I came back and I decided, I didn't get the kind of answers I wanted from my podiatrist. So let me try AI. So I went to Claude AI. I'm a fan of Anthropic, and I like their standing on AI security. So I'm a big fan of Claude right now. I think it's the Claude Sonnet is a great release right now. I think it's got a lot of you can give it a lot of context, which is great in the free version. And I find that the answers are really pretty good. So I went into Claude AI and I said, pretend you're a podiatrist. I told it to ask me any questions it needed to put together a differential diagnosis. So they do this a lot in training where they're like, okay, here are all the possible things that this could be. What's sort of the protocol for next steps? It was nice because the AI actually asked me very thoughtful questions, and it produced a really nice differential diagnosis. Here's what I'm going to say. I am not a doctor. I am not giving medical advice, nor should you look and seek medical advice on your own on the internet, because that is a losing battle, man. I will tell you that. But the thing that I thought was really great about this is now I have a set of differential diagnoses that I can go to my doctor with and say, hey, have you thought about this? Have you thought about that? It just makes my time with the doctor more productive, because at the end of it, Claude AI produced a list of the conditions that should be investigated and why it thinks that. So now I have something I can walk into the doctor with, and I can say, hey, here's what, I fed into it, and here's some of the things it thinks that I may have. Do you want to take a look at this? Maybe that can, help expedite some of the things that you need to do to treat me. So I think there's an opportunity here to use AI as a bit of a patient advocate component to your healthcare. Like I said, I wouldn't trust it to give me a diagnosis. I would always keep a doctor in the loop on all of these things. But at least it can give you some starting points to investigate things more thoroughly, so that I don't have to go to my podiatrist, who basically said, well, I think it's, an Achilles tendon thing. Go do the thing that you've been doing for 4 months already and just do it more. I mean, that's not helpful to me. And I know, he doesn't have time to really go through everything. So I think there's a benefit here for everybody. So I'm going to show you what I put in, what it came back with, and how to just do that real quick. The first thing I'm going to do is go to Claude AI. I am using Claude AI because I like Anthropic's business model, and I find Claude 3.5 Sonnet gives me pretty good results. But that said, you can use probably pretty much any LLM with this process. So the first thing I'm going to give it is I am going to say, pretend you are a podiatrist. This is the first prompt I'm going to give it some context. And then the next important thing that I am going to say to it is provide a set of differential diagnoses for heel pain. And then I'm going to give it a little bit more context here. The patient is experiencing a burning pain in the back of the heel. The pain gets worse with use. And we'll throw in a little bit of a complicated thing here. The patient has stated that they have a Dupuytren's contracture nodule in the arch of their foot. The affected foot is the right one. There's another complicating factor here we'll add in. The patient was recently diagnosed with diabetes. So then we're going to tell it to ask as many questions as you need to come up with the diagnoses. So we'll enter that in, and then it'll give me a set of questions it wants answers to before it makes a diagnosis. The patient is 58 years old. The heel pain has been present for 4 months and has gotten worse. Pain gets worse during the day, but is initially worse after getting out of bed. Laying flat seems to help with the pain. The patient has been playing pickleball, but has had to stop due to the pain. There's been no significant change to the footwear. The patient states that they have a wide foot, so it's difficult to find shoes that fit well. There is no redness or swelling and is not particularly sensitive to the touch. The pain extends from the bottom of the heel to about an inch up. It's asking, did you experience any numbness or tingling? There was a little bit of numbness that coincided with the start of this issue. The diabetes is well controlled. The diabetes was diagnosed in April. Patient was on statins but discontinued due to leg pain. Oh, and I did go to urgent care, and I did get an x-ray, so probably should mention that. And that didn't show any fracture. Let's see what it says. So here is what it did. It produced 8 potential diagnoses here based on the information that I gave it. And then it produced next steps here. To further narrow down these possibilities, I would recommend yada, yada, yada. Thorough physical examination, including palpation of the plantar fascia and Achilles tendon, nerve connection studies to assess for tarsal tunnel syndrome and peripheral neuropathy. So then it produced some recommendations to follow up with, and these are things that I can take to my doctor. Last thing I would suggest is you can also then just say, please summarize this differential diagnosis so I can present it to a doctor. And then it summarizes all the details, gives me the differential diagnoses, and recommended further evaluations. Hopefully you use this information responsibly. Hopefully YouTube doesn't, take this down or downrank this because I'm talking about medical stuff. It happens sometimes. And hopefully you get something out of this. Hopefully this can help you improve and advocate for yourself more in your healthcare. And I will see you in the next video. And if you get a chance, give us a like, think about subscribing, and I'll see you in the next one.